Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
It's Lindsay Smith-Rogers. Today, all about Zyn. Researchers Meghan Moran and Johannes Thrul join me to talk about Zyn Nicotine Pouches, what they are and how they work, how they're marketed, and what we know and don't know about their long-term health effects and whether they could be a viable tool for helping people to quit tobacco products. Let's listen. Meghan Moran and Johannes Thrul, thank you so much for joining us on Public Health on Call today. We're going to be talking about Zyn. And to start us off, what is Zyn? Meghan, we'll start with you.
So Zyn is a brand of oral nicotine pouch owned by Philip Morris International. But it's not the only brand of oral nicotine out there. It just is, I think, the most popularly used one and the one that's getting the most media attention. So to kind of scope out a little bit, oral nicotine pouches are these little pouches that contain nicotine powder, and they're placed between the gum and the lip. They come in a variety of nicotine strengths and flavors such as citrus, coffee, mint.
What makes these different from other products that might have been similar in the past?
So they're being marketed primarily as being, quote, tobacco-free, which is just another way of saying that the nicotine in them is synthetically made in a laboratory as opposed to coming directly from a tobacco leaf.
And Johannes, let's talk about what we know about nicotine and health.
Yeah, happy to take that one. So nicotine is a highly addictive substance. We know it's not the primary cause of diseases that we usually associate with tobacco, like lung cancer, emphysema, or COPD, for which we know the real culprit are cigarette smoke and the thousands of toxic chemicals that are created by combustion, right? By burning and inhaling tobacco plant material. But nicotine also has some serious health implications. So it stimulates the central nervous system and can raise heart rate, blood pressure, blood sugar levels, and it's associated with cardiovascular stress and can worsen existing conditions for people with heart disease, for example. The one thing we also worry about is for adolescents and young adults, nicotine exposure can interfere with brain development. We know that the brain still matures up until your mid-20s, even your late 20s, especially in areas related to attention, memory, and impulse control. The prefrontal cortex is what we talk about a lot in that regard. And so there's a growing concern about nicotine use in youth, even if it's nicotine use in absence of the combustion, right, like burning of plant material.
What do we know about long-term impacts of nicotine addiction? Meghan?
So we know that addiction is not an outcome that we want for anybody. One of the places where this is most concerning is with young people in particular who truly do not understand what it means to be addicted to a product and are likely to underestimate the propensity to become addicted. So they think maybe I'll just try this once or a few times, and before they realize what has happened, they become dependent upon nicotine. And that's not a good place to be. I am very concerned about the likelihood of young people just developing nicotine dependence as its own negative outcome. And then I think Johannes will be able to talk a little bit more about nicotine and its health effects in general.
Yeah, I'm happy to talk about that. So the issue with nicotine and the long-term consequences of nicotine addiction is that these novel products haven't been around for that long for us to study what are the effects of just nicotine if we take out the, say, like 7,000 other chemicals that are in tobacco smoke, right? And so it's been very hard to study the long-term effects of cleaner products, right, that don't have all of these chemicals in them and see the long-term effects of what it is for just chronic, repeated nicotine administration over extended periods of time. So in a lot of ways, users of these newer products are a bit like the canaries in the coal mine, right? Like we don't know yet what long-term administration of these new products will do to you.
Johannes, what do we know about how addictive these things are?
Yeah, so what we know is they deliver a good amount of nicotine. So nicotine is not like this uniform substance across all products. It's delivered differently depending on the method. So for smoking, it's pretty clear. You burn the cigarette, you inhale the tobacco smoke, and then it gets metabolized through your lungs and gets into your bloodstream and then into your brain. For these pouches, they are absorbed. The nicotine is delivered through the mucous membrane in your mouth, and they come in high doses up to, some of these have up to 12 milligrams per pouch in some cases. And so that, in terms of the nicotine delivery, that makes them more comparable to cigarettes or vapes in their addictive potential compared to what we know from, say, like the FDA-approved, clinically tested smoking cessation nicotine products like the patches or the gums.
So it is a higher level of nicotine in these pouches?
There's a higher level of nicotine if you compare, for example, to a patch. So they come in different strengths, right? But they can get very, very high.
Okay, thanks for that clarification. You've both done a lot of research about who's using Zyn and how it's marketed. What can you tell us about this product, Meghan?
Yeah, so we know that people use these products for a variety of reasons. We've done some work that found that interest in flavors was a big reason that people were using the products. There's work also showing that people use these products, and they're also marketed in this way, as a way to get nicotine when smoking or vaping is not allowed. So people who are already using a tobacco product, a cigarette or an e-cigarette, and who maybe during work or on an airplane or something like that would want to use the product. We know that people sometimes use this product because there's a perception that it can enhance cognitive abilities to be productive or focus. And then also, in particular, among younger people, curiosity is a big driver as well. It's just simple interest in what is this going to be like? Maybe they see other people using it or they've heard about the product, and they simply just want to know, what is this going to feel like? How will I feel? What will it taste like? And so forth.
Is the conclusion that people are drawing about the cognitive ability, is that because this is a stimulant?
So the literature is kind of mixed here. There's some studies showing, and I think people will point to this, that nicotine can enhance cognitive abilities. But when you look at maybe more well-controlled studies or studies that account for other factors, some of that effect tends to go away, because if somebody is already addicted to nicotine and then they're in withdrawal, then they're not going to feel so good. And so then when they do get nicotine, there's going to be this experience of like, wow, now I can I can really concentrate on the paper I'm trying to write or whatever I'm trying to do. And so it's this kind of like self-reinforcing effect. But then when you start to really look at, well, in someone who's maybe like naive to nicotine, are they experiencing that same effect? Then it's not so sure. It's not as clear of a picture. But the important thing for use motivations is simply the perception that people think this is going to be an effect, and it may in fact be self-reinforcing as they continue to use.
Are there particular groups that you've really seen the marketing target?
Initially in our work, we've been analyzing just about every piece of marketing material we can get our hands on over the past 3 or 4 years. We initially saw marketing that seemed to be targeting people who use cigarettes and e-cigarettes. So a lot of marketing about how this product was discreet, that it was smoke-free was a term that we saw a lot, that it was odor-free, kind of implying that this is different than the product that you're already using. Over the years, we've seen those claims decrease. And what we've seen more is an increase in claims that the product is convenient and easy to use, which potentially could be appealing to somebody who uses a cigarette, right? It certainly is more convenient than lighting up a cigarette. But at the same time, it could be quite appealing to young people as well, who may want to use this product and not have it be discovered by their parents or their teachers. And so that's a real concern, is the extent to which the marketing is going to appeal to young people, and in particular, young people who are not using tobacco.
We've had an ongoing conversation on this podcast about how effective products like these are for helping people to quit smoking or other tobacco products. We will link to those episodes in the show notes so people can go back and listen to what we've already talked about. But what we've learned is that it's a really nuanced conversation. So where does the judgment come down right now on Zyn in particular as maybe being an effective tool for quitting smoking? Johannes, I think this is your area of expertise.
Yeah, it's a great question, and really it's at the heart of the public health debate in a lot of ways, right? Like, are these products helpful stepping stones for people who are trying to quit smoking, or are they just repackaging nicotine in a more socially acceptable form and drawing in new users or keeping existing users hooked on just a different set of products or a new product mix? And so the reality is that these pouches are a bit in a gray zone, right? They're not FDA approved for smoking cessation, and they've never gone through the same kind of clinical trial testing that, say, like gum, a patch, or the medications like varenicline have. So we can't really say with confidence that they help people quit smoking in the way that we can say for other cessation tools, frankly, because the science is not there. With that said, there is anecdotal evidence that some adult smokers are using Zyn or similar products to cut down the number of cigarettes they smoke or move away from combustible tobacco. So from a harm reduction standpoint, that's promising. Those are promising signals. We know that smoking is incredibly harmful, so switching to a non-combustible product could reduce some of those risks if the switch is total, so totally away from combustion, and if eventually somebody can then quit all nicotine products. The flip side is that a lot of people don't switch completely. We know this. We see some patterns of dual use with smoking and nicotine pouches, as we see with vaping and smoking and vaping and pouches. And that can actually sustain or maybe even deepen nicotine dependence rather than helping people quit. We see, as I said, similar things with smoking and e-cigarettes, where dual use often then delays complete cessation rather than accelerating it. So we got to be realistic. Meghan mentioned the marketing strategies, right? These products are flavored, easy to hide, often framed as healthier or cleaner nicotine options. And so that messaging can reach not just adult smokers, but it's reaching teens, it's reaching young adults and people who might otherwise never have used nicotine. So they might reduce harm for some people, but it may also expand harm by hooking new users that have not used nicotine before. So I think that's why regulation is so crucial here, that we need systems that make sure that these products are available as low-risk alternatives for smokers, but not widely marketed or accessible to youth. And that could mean restricting flavors, tightening marketing guidelines, enforcing age verification in a more tightly controlled way, and also requiring robust scientific evidence before these products can make any claims around health, but also around smoking cessation. So I do think they might have a place in a comprehensive harm reduction strategy framework, but without regulation and accountability and without the rigorous science that we need to prove that they actually work, there's also this risk that they might just become a new way to retain nicotine addiction because they are so easy to be used. So they don't come with the smoke, they don't come with the smell. We have a new set of products that help people essentially conveniently maintain their nicotine dependence. So that's kind of the tension that we see in that space.
And big picture, do you see this kind of scientific research starting to happen? I mean, these products are still fairly new, right?
Yeah. So it's early. There is a lot of attention on them, interest. With any new product that's coming out, once we see an uptick in number of people using, that tends to be like then scientific research that follows that we see anecdotal evidence, right? It might be people on Reddit talking about how they might use pouches to help them move away from smoking cigarettes. Really, at the end of the day, we need clinical trials that clearly demonstrate if you randomly assign people to a pouch or to another product or different strengths of pouches, if those help people quit smoking. And then if we also see that people in the real world are using these pouches in the way that will help them move away entirely, because sometimes what you see in clinical trials and what you see in how people are using products in the real world is not always one-to-one congruent, because in clinical trials you see better outcomes for, say, like nicotine gum and nicotine patch in clinical trials than you see in real-world implementation, because we know that the best evidence for smoking cessation is when you combine the pharmacological help, right, like nicotine replacement or medication, with the psychological smoking cessation counseling that really help mentor people through the process. That's where we see the best results. And in a lot of real-world implementation, folks tend to just try a nicotine replacement product. They don't usually try it the way that's like, they don't necessarily read the label, right? And then they stop maybe prematurely. So we just have to see a bunch of different streams of evidence that have to come together for us to say, this is what the products are doing, this is what they're doing in the real world, and whether or not they're helping with smoking cessation.
Meghan, I want to make sure that you get some time to chime in on this.
Yeah, so I just wanted to add to what Johannes said. We're part of a team that's studying these products, and our colleague on the project, Dr. Tori Spindle, who's at the School of Medicine here at Hopkins, is doing a study where he's looking at the pharmacokinetics of the nicotine delivery of these pouches, specifically to understand the extent to which it could be a viable substitute for the nicotine delivered by cigarettes, and therefore give us that kind of information we need to understand, as Johannes was saying, maybe the best way to guide somebody who is trying to use these products to stop smoking, so that it could potentially result in smoking cessation, as opposed to maybe dual use, which Johannes was indicating often happens when people try to use these products to quit completely on their own.
It doesn't escape me that Zyn in particular as a product is made by a tobacco company. So how does that fit into the conversation?
It's frustrating in many ways. I think we see a lot of talk from the tobacco industry about how they are envisioning a, quote, smoke-free future, and yet they continue to sell cigarettes. In my opinion, if they were truly committed to a smoke-free future, the easiest way to accomplish that would be to take their smoked products off the market. We've seen language like this before. A lot of it seems like just PR as opposed to a real commitment. And so it's always good, I think, to be a little bit cynical when we see this kind of language from the tobacco industry, given that they are the manufacturers of a product that continues to be the number one cause of preventable death in the United States.
This has been incredibly helpful. Thank you so much, Meghan Moran and Johannes Thrul, for bringing all kinds of context to this new product that we're seeing marketed everywhere. Thanks for joining us.
Thank you for having us.
Thank you.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Grace Fernandez-Cesiri. Audio production by J.B. Arbogast, Michael Bonfils, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production coordination by Catherine Ricardo. Social media run by Grace Fernandez-Cesiri. Analytics by Elisa Rosen. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.